keeping them pain-free is a big fear. A lot of people think they're going to die in pain, and statistics play out that a lot of people do die in pain. And our job is to not make that happen.
So you're saying that the fear of becoming addicted to the pain medication should not play in the scenario here.
Absolutely not.
That they shouldn't worry about being over-medicated. Perhaps they're under-medicated.
I think that's another fear people have. People think that if you give them pain medication, they're going to be zonked. And that's not true. Our goal is to give you enough medication that you can be awake and alert and spend quality time with your family. So, you know, you need to talk to your healthcare providers about what your fears are. You know, people say, well, the other fear is, you know, oh, I don't want to take morphine now because, you know, when I get really bad, then what are you going to give me? You know, we can always dose you. Pain experts really know what medicines work, how to increase them, how to, you know, titrate your doses to keep you comfortable up until, you know, the time that you die. So you really don't need to be afraid of getting morphine. You don't be afraid that there's not going to be enough medicine for you at your end of life. We're able to coordinate that for you.
So your experts are able to determine the appropriate dosage, when to give it, and if a patient is expecting a family member to come, to make sure that they're comfortable and alert to be able to enjoy their visits.
Exactly.
And so you're adding quality of life, and this is the word you used earlier. Quality of life is coming because the appropriate type of pain medication is being administered by experts who care for you.
Right.
Okay, so we're getting to the point now where we've mentioned there's also alternative means where people can get comfort as well as pain medication, which is being administered by appropriate physicians and the nurses who care. What else can a patient look forward to sort of just ease out of that discomforting time, or to allow them to feel a little bit more comfort?
Many people find it beneficial to have massage therapy, somebody to hold their hand, a scent and aromatherapy, something that brings back memories. You would be very surprised at the power of smell and odors and how comforting it can be. To have music played, to have guided imagery or meditation. They're all different things that people can do, and the family can definitely be involved in a lot of these different alternative methods for pain relief.
A lot of times families feel helpless. You know, they don't know what to do. Their loved one is dying, they're watching them in the bed, they're watching them deteriorate. Suffering is equally as hard, if not harder, for a family member than the patient experiencing it, because they're watching their loved one deteriorate and they know what's coming. So we want to give them things to do. We want to teach them how to massage their feet and put oil on their feet, to dab a little dab of essential lavender oil on their pillow before they go to bed to help them rest a little calmer, to be able to do a hand massage, you know, to play some music with them and talk to them about deep breathing and just relaxing their body to help their medication work.
So you're telling me that this alternative component isn't necessarily from somebody within the hospital, it's something that the family can do. And you're saying that it's okay to give a massage, it's okay to tell a story, it's okay to reminisce about the past, it's okay to tell a joke. I suppose laughter can be the best medicine sometimes as well. And this is giving the patient's family an opportunity to communicate and to interact with the patient. And maybe even, they must even feel guilty, maybe, that they're sick and I'm not, that type of thing, especially in pediatrics and everything, right?
It's not just that, it's also the shared experience at the end of life. It's a bittersweet moment. It's the conclusion to what Fran had mentioned before, the introduction of life and the end of life, the quality of the dying process and the life process. If they can share a moment, if they can remember that they were able to give their family member comfort at the very end of life, is a gift that the family will never forget.
The worst thing you want a family to say is, I wish I would have said. I wish I would have done. If we could only have done it one more time. By talking about end of life and by providing palliative care, which increases quality. I mean, there are studies now showing that people live longer with palliative care because their symptoms are managed and they're able to do the things they want. So we really want people not to, after a death, say, I wish I could have or I wish I would have, but to help them to get there before it's time.
You know what I hear you two saying? I hear you wonderful ladies saying that you give permission to the families to be able to interact with their loved one, to reach out and stroke their hand, to reach out and put a dab of perfume on their pillow, to tell them that they love them, to tell them that they are glad that they are there with them at this moment. And you're saying it's okay, patient and patient's family, to talk, to share, and to show that love. Is that what you're saying?
You got it, exactly.
I think it's even a step further. It's not really permission, but we include the family in the healthcare team of the person at their end of life. We want them to feel that they can act on their instincts, which they naturally have as human beings. Well, it's a more holistic approach.
I must say, though, a lot of people feel constrained in a hospital setting, which is a very formal setting, and there's rules, and there's people walking in and out and all that sort of stuff. So they don't want to interfere with the process. And that's why I'm saying you're offering permission to the families to be able to interact that way.
A lot of hospitals are changing their rules now. They're going to eliminating visiting hours so families can be there more. They're going with, now at Overlook, we have a room for the families where if a family's sitting vigil for a long time and they want to get away and relax, they've created this beautiful room where they can go, and if they want to check their email, there's a computer. If they want to listen to some relaxing music, that's there. If they want to sit in a comfortable chair and recline, they can do that. So a lot of hospitals are really looking at those constrictions that we put on families that don't allow them to really be with and be present with their loved ones.
I find that most wonderful to hear. It's very rewarding, and I know there's also other resources out there that patients and their families can go to for help. Can you mention some of them?
Would you like to start, Fran?
Sure. The Morristown Hospital, Dr. Knops runs the palliative care program there, and there's a website that's going to be across your screen that you can go to look at. I think it's www.atlantic.yhaonline.com or .org. It's going to be on your prompter. Mm-hmm. And Dr. Knops answers 200 questions about different aspects of palliative care. So you can go there. Plus you can, if you're in the hospital, ask to talk to the palliative care team. Don't be afraid of them. They don't want to talk to you. You know, they just want to find out what your family's goals are and how they can help you to make your life and your loved one's patient's life the best that it can be for the days they have left.
Okay.
And there's also a national website with the American Pain Foundation. It's www.painfoundation.org. This provides not only information for end of life, but all different pain-related issues, as well as hyperlinks to things like the hospice and palliative care organizations, as well as many others, and very disease-specific as well. Mm-hmm. There's also a part on there where people are able to interact with each other, whether it be people in pain or family members or healthcare providers, that they can discuss between them what they're going through and provide emotional support.
Thank you much, ladies, for a most informative, very moving, very touching program. And thank you for joining us today on 30 Medical Minutes.